I'm going to present on improving first ANC coverage in Dewa Sub-County. And Dewa Sub-County is in Homa Bay County. So I'll go in this order. So we have the background, have the method, the results, conclusion, and finally the acknowledgement. So in the background, Homa Bay County is one of the 15 counties in Kenya that are leading in maternal mortalities. So our maternal mortality stands at 583 per 100,000 live births versus the national that is at 362 per 100,000 live births. Neonatal mortality is at 33 per 1,000. Infant mortality, 77 per 1,000. Then child mortality at 130 per 1,000. If you look at those data, you'll find that it is so alarming. So I was triggered to see a way of maybe working on reducing the maternal mortality. So Dewa is one of the sub-counties in Homa Bay, and this study was the data of 2017 and 2018. So in 2018, Dewa sub-county had a total population or catchment population of 210, 131 people. So women of reproductive age were 50,432. So according to the DHIS data, in 2017, this was the performance of Dewa sub-county. So for family planning, we were at 32%. First ANC, we were at 81%. Fourth ANC, we were at 35%. Then we had skilled deliveries very low at 42.1%. So we realized that we had very low fourth ANC attendance. And when we went down to the reasons why our fourth ANC or our women were not completing 4 visits, we found that most of them were starting their ANC late, and most of them were at second or third trimester. So the 2018 performance, family planning was standing at 35%. First ANC, this is now after the innovation that we did, we found that it slightly went up. So it was raised by 10%. Then fourth ANC, we went to 53, which was a great improvement. And in a while, I'll let you know what we did, and finally we got this data. So also our skilled deliveries went to 59%. So this is the ANC coverage. For 2017, this is according to what I've said, but it is just now in bar graph. In 2017, first ANC was at 81%. Fourth ANC was at 35%. Then in 2018, we got 91% for first ANC. And for fourth ANC, we got 53%. So this is the methodology that we used. It was a kind of cross-sectional study which was used to determine how many pregnant women were invited by fellow pregnant women. We realized we have the MOH structures where we have the CHVs at the lower tier, that is level 1 or tier 1, but we found that there was some sluggishness, of which we went a step further to see how can we get these women come to our facilities for the first ANCs early enough. So this is the reason why we went down to these women, and we told the women who have already come to our facilities to kindly invite their friends, the friends that have not visited any facility. So the study targeted pregnant women coming to the study was done in 20 facilities. So these women were told to invite their fellow women who are pregnant but had not attended any ANC clinic. So I've already said the study was done in 20 public facilities out of the 38 public facilities that we have. So 2 of the facilities were health centers and 18 were dispensaries. These were the results. So baseline survey or baseline data was gotten in January 2018. So this was kind of a retrogressive kind of data. So in 2018, January, we went back to our facilities and found that in 2017, we had not done well. So in the 20 facilities, we told the women to invite their friends, of which they did. So finally, we got the results. We found out that it can work. You can just use a client to invite another client, and you'll see marvelous. So our data rose from 81 to 91%. So in conclusion, there was a marked increase in the number of pregnant women attending first ANC in Dewa sub-county. There was also an increase in fourth ANC attendance because of early identification. You realize that I'd say that most of our women were starting their ANC late, and therefore they were not getting enough opportunity to attend our clinic 4 times. So when they were invited, they came early enough, and we were able to work with them the 4 times in our clinic. And finally, you'll find that also the skill delivery rose, because most of the time we were talking about also skill deliveries and the services that we were offering in these maternities. So our acknowledgement went to the ANC mothers that participated in the study, the nurses who were in the 20 facilities that also accepted to work with us, then EGPAF team also, since their mandate is to reduce the number of women who are, it is a PMTCT kind of program, so they were also very happy to work with us, because during the first identification, this is where you can test the mother during the first visit and find out whether she is HIV positive or not. And if they are caught early, the interventions are going to work in a good way. Otherwise, thank you very much, and God bless you.